You're the guest.
Got it.
Hey, everybody. I am so excited today to be here with fellow physician as well as MIT alum, Dr. Celia Simone. We'll be talking about now that Roe is gone, what every educated person should know, starting with some basics about mifepristone and medication abortion, and then some resources. So ask your questions and hopefully we'll be able to see them, but if not, we'll answer them afterwards. And I think actually we'll have to answer them afterwards. But I hope you'll share this and I hope it'll be useful. So Dr. Simone, take it away.
Hi, I'm Dr. Simone Celia Klein. I am an MD who graduated from UCSD in 2016. I also graduated from MIT in 2009 with degrees in physics and biology. Um, and basically, I have started to create a YouTube channel on different topics, including medicine, including women's health, skiing, and other things I am passionate about. And because of that, I wanted to get on here and talk to my friend Sophia Yen about Dr. Sophia Yen. We got to make sure us women are represented as doctors. About women's health and reproductive rights in a post-Roe world. So one thing that's been on the news a lot recently is mifepristone. A while back, some guy down in Texas decided to get rid of the FDA ruling, and it got sent to the Supreme Court. Thankfully, the Supreme Court denied that and sent it back to the Fifth Court of Appeals. But we'd like to talk a little bit about it and why it should, why mifepristone is an important drug to have on the market, regardless of Roe versus Wade or not. Or Roe versus, yeah.
So, I think first of all, important for people to know that the standard medication abortion in the United States, the protocol that's been happening for 23 plus years, is mifepristone and misoprostol. And certainly you can do a medication abortion with just misoprostol, but it's not as effective and has more side effects. So to me, it's like tying one arm behind my back. Why would I use an inferior product when this great product has existed for 23 years? The other important fact to know is that the majority of abortions are now, I believe in the first trimester for sure, done by medication abortion, which kind of blew my mind because I work with teenagers and my experience has been they like surgical abortion, put me out, do it, and then wake up. But medication abortion, the beauty of it is you can do it whenever you want. So if you want to plan it over the weekend so it doesn't affect your work or other things like that, as opposed to a surgical abortion, you only can go when the clinic's open, when it's available. You have to sit there, you have to face the protesters, etc., stuff like that. So medication abortion, I could see the benefits of that, but there's bleeding and cramping that you have to deal with at home, whereas the other one, it's like done. So medication abortion is now the most common form of abortion, at least in the first trimester.
Another thing to note is that they're not just used for like elective abortion. They're used for incomplete abortion. So when your body has had an abortion and it hasn't expelled the products and you just need to get it out, where if you don't have that, you have to go in surgically. Another
So a
thing,
miscarriage.
or
A miscarriage.
a miscarriage. We sometimes call them incomplete abortions in the healthcare world. Another thing is that there is another on-label use of mifepristone that isn't actually discussed, and it's used for high blood sugars due to Cushing syndrome in patients with diabetes who are either not good candidates for surgery or hasn't responded to surgery. So it is actually an orphan medication. So basically means this is the only thing that there is to treat this by the FDA. And by getting that, you would get rid of that indication as well, basically throwing the baby with the bathwater.
And it's just crazy because it's been legal for 23 years. Millions of women have used it. It's safer than Tylenol, which is over the counter, safer than penicillin or Viagra. And so, as I like to say, you take away this, we've taken away Viagra.
And Another thing to note is it's approved in the US for 23 years. It was approved in 2000. However, in France, it was approved in 1986.
Wow.
So there's even more years of safety data that's out there. So it's a fairly safe drug. And by getting rid of it, it gets rid of this whole area for people who have had miscarriages and will have to sit with the products of conception for even longer and deal with the pain, because most of these people want these babies. They want they wanted it, and it's just hurting women. And I feel like a lot of what's going on is just like in this post-rural world in areas like Texas where they banned that, it's really changed the standard of care for women. There is a 2 times increase in morbidity, and women are due to having to wait, there are increased, hysterectomies, increased tube bursts due to ectopic pregnancies, and people that aren't getting their care because they're too scared to go to the doctor because they're gonna because something went wrong.
Yeah.
Um,
It's so important to realize that, when we say abortion in medicine, there is spontaneous abortion, which is a miscarriage. There's incomplete abortion, which is a miscarriage. It didn't finish. And so we have to finish it. Otherwise, it will turn and die and infect the person who's carrying it. And that could lead to sepsis. And then the person dies. And that's what happened in Ireland to a woman, unfortunately, wherein they had abortion. She had to sit in the hospital until she was almost dead. And then they could attempt a termination, but then it was too late and she died. And that's when Ireland, stood up and said, no, we're going to make abortion legal, because what we've done is killed somebody that absolutely could have been saved, should have been saved, and that the pregnancy was already gone. And there was no saving that. So you need to save who's here and who could have another baby and not destroy a family. 60%, I think, of people that have an abortion already have children, and they're doing it because they can't afford another child. And if the states that have the most restrictive abortion laws are also the states that are least likely to support you if you're poor, you have a baby, if you are a single mother, and if you really want to support the choice to continue a pregnancy, then you need to fund that side and not just punish people who want to terminate a pregnancy. And even then, the people who don't want to terminate a pregnancy but had an unviable pregnancy that tried to terminate itself, and it needed to be finished for the safety of the person who's still here, for the person who has a uterus.
well, there was a great paper that was just released by UCSF that they gathered a bunch. They basically, from these states, they got doctors to submit. Well, the doctors weren't quite anonymous, but they anonymized all the patients. They were allowed to speak to the doctors, and doctors presented case reports of patients that were not treated with what was previously the standard of care. And for different reasons, whether it be there was one person who wanted an abortion, but she'd already had like 6 other children. And in her previous pregnancy, she basically developed cardiomyopathy so basically her heart got bigger. And the doctors told her it would be unsafe for her to have another pregnancy. And she got pregnant. And, she has to take care of all these other kids. Or there was one that I was just astonished by. Someone had an IUD in, but it moved from the fundus, so it was no longer where it should be, and it was in the vagina, or basically like popping out the cervix, or they could barely see it, but it wasn't where it should be. And the person got pregnant, and the doctor refused to remove the IUD to allow, because the IUD could get in the way of the pregnancy and get in the way of the fetus. But there are case reports, if you remove the IUD, it could cause a miscarriage. And the doctor didn't want to be responsible for that, so they couldn't even remove the IUD to allow the pregnancy to proceed as normal. They just couldn't do anything. Their hands were tied because it was too much danger of criminal persecution for these doctors who are just trying to do standard of care. And a lot of them are thinking of leaving the state because it's causing a lot of burnout.
Yeah, I mean, we take an oath, do no harm. And to see somebody on the cusp of death or having to wait until we decide they're close enough to death to try to save them, that is just, heart wrenching and not okay. And treating those of us with uteri as second class citizens. We we are here and now, and the fetus and embryo is a potential, and to value that above that which is here and now. And I'm like, my husband would much rather that I'm here than I am dead, because I have two children and he would not want to be left with them alone. But if things are illegal and women have to take things into their own hands, that's the risk that we're putting those people with uterus in. That, my OB-GYN professor at UCSF said nothing will come between a woman and a wanted pregnancy, so she will get pregnant. So watch out, use birth control, and an unwanted pregnancy, that she will do whatever it takes to terminate that pregnancy. So when you make abortion illegal, you don't make it go away. You just make it more dangerous for those people with uteri.
And another thing is all of these cases, like these women who want them and are being put into situations where, the placenta doesn't attach correctly. And it's putting them in a situation where they're going to have to get a hysterectomy, or they're going to have to, they're going to have tubes burst so that they can't have another child. So that is a big problem, because basically in the past, in these situations, you would terminate and try again. And in these cases, in order for that to happen, they have to go out of state, and there's very long waits. And it makes it more and more complicated, and it increases the risk that somebody is going to have something that is going to make them sterile, which is kind of against what they're trying to do. They're trying to bring more babies into the world, and yet they're basically putting it in situations where women can't make more babies, especially if they want it.
Yeah.
So what can we do about
termination? Sometimes you have to do a hysterectomy, and definitely for tubal pregnancies, that's not going to live, and you can't transplant it. It will only grow and blow up, and if you don't catch it fast enough, the person with the uterus will bleed to death. So there's no point waiting until the person carrying the tubal pregnancy looks like she's going to die to try to terminate that pregnancy, because by then you may not save that person's life. It's just all sorts of crazy.
There was another case mentioned in the thing where methotrexate is if they catch it early enough, they give this drug methotrexate. Thankfully, that isn't on their radar yet.
Hopefully you didn't just bring it to their radar.
Please don't. We need methotrexate for many things.
Usually for chemotherapy for cancer.
Yes. So they give methotrexate. So somebody was caught having a suspected tubal pregnancy, was sent to the emergency department, and the emergency department was too scared to give a methotrexate because they weren't able to completely be certain it was a tubal pregnancy, but they were pretty high certainty, and they wouldn't do it because they were scared that that would open themselves to liability of possibly terminating a pregnancy. And it's frustrating.
Yeah, it's really about thinking ahead, because no one thinks about abortion till they need it. No one thinks about, well, I mean, a lot of people do, progressives and those, but like the majority of the people's like, not my problem. And then when you get to the ER, it's too late. Or when you have that ectopic pregnancy, which is a pregnancy in the tubes, anywhere outside the uterus is an ectopic pregnancy, and you might die if it blows up, then it's really you, but that's too late to deal with the rules and the laws. And so we really need to think ahead and protect the right to bodily autonomy. And as I like to say, freedom of religion. Your body, your religion, you do what you want. My body, my religion, I do what I want,
Well, also a big thing to think about is also protecting the doctors. The doctors, like most of the there are a lot of pro-choice doctors out, or pro-choice and pro-life doctors out there. But even the pro-life doctors do think there is a place for abortions in this world when the fetus is not viable, when there is severe medical complications, when they don't think the fetus is going to get to term or it's going to die shortly after, or, you know, if there's premature rupture of membrane, so basically the water breaks and it's too early. And in these cases, even these pro-life doctors, the standard of care in certain cases is to abort. And so this has to be thought about, and it's actually causing a lot of problems with doctors, because doctors want to do what's best for the patient. And when they can't, it creates a whole bunch of a moral dilemma, as this is what's good for the patient, but if I do that, I might land in jail. And doctors don't like basically being stuck in handcuffs to do the right thing and to do what's a standard of care.
I think no other profession do you expect that person to go to jail for you. Do you expect that person to lose their license and their entire livelihood? Like when I was bright-eyed, bushy-tailed, not married, not without children, sure, I'll do anything to protect my fellow XX, and to preserve the right to decide what happens to my body. But now I have a husband, I have children, I have mortgage, I have college I got to pay for. I can't just go and lose my job. I can't just go and lose my license. In no other profession are people like, well, the doctors just break the laws. There, no other profession are you asking people to lose their entire livelihood for you. And if you are, then you need to be making sure you vote for all the right people. But even then, you need to step up and risk your profession. Like, don't ask me to do something you wouldn't do.
And I mean, it's getting to a certain state. Like, there aren't a lot of providers in Texas. Like, people will have to drive if you're in rural Texas, you have to drive multiple hours to get to any OB. And if those get so frustrated that they get up and leave and go somewhere else, it's a problem. People aren't applying to residency programs in these areas in OB because they're concerned that they're not going to get a proper education. They're not going to learn what the true standard of care is. And they're actually teaching like, well, and this is how we do it in this state. But in other states, they do it like this. And so when you don't have enough people coming through residency and staying in an area, you're going to lose even more doctors, and it's going to become even more dire. And what do you do when you have no doctors left?
Yeah, because the doctors, the same ones doing a termination of pregnancy, are the same ones doing a delivery. So if you don't have those doctors, then you're going to miss the ones that you need for your delivery, the ones that you need for your endometriosis, the ones that you need for, any other kind of gynecological issue that you may have going on. So I do think it's important. I have a couple of tips. Number one is everybody should know about plancpills.org. It's a nonprofit website, and it has anything you could possibly want to know about medication abortion. The thing that's also interesting is you can put in your state, and it will list from cheapest to most expensive your medication abortion options. It will also list by distance as well. There is a service called Aid Access, and I believe the physician is Dr. Rebecca Gompertz. She was originally Women on Waves, if you haven't heard of that. She used to take women in Europe out on a ship to international waters where there is no law, perform an abortion, and then bring them back. And so that's like the crazy pirates and no law situation. And then she realized, I don't have to take people out on boats. I can just give them medication abortion pills and send them in the mail. And so she has set that up for the United States, where she writes the prescription from the Netherlands. The medications come from India, so nobody in the US goes to jail. Plan C pills, for that service, I believe it depends state by state, but I think it's $110, and you can get it in advance of need. So just have it sitting there in case anything happens. If you ask for it in advance of need, oftentimes you can get one that expires 2 years from now. And so it might be a good investment per dorm, per block, per group of 10 girlfriends, whatever, in case anyone needs it at any time, so that you can, as soon as you miss that first period, pee on a stick and take the medication. Or even more radical, Plan C's suggestion is you miss a period, don't check a pregnancy test, and just take the medication and make your period come, so that it's not an abortion if you never had a positive pregnancy test.
That is very interesting. Also, in Texas, you got to make sure no one else knows about this, because apparently there are people that are trying to turn you in.
Yes,
there are doctors.
yes.
There are
laws that just for sharing that website, doctors can't share that website. Though they're made a film, Plan C Pill, the movie, and so they can talk about this movie, but they can't talk about the website.
That is amazing. You should check out Plan C film.
Yes.
I will go check it out myself.
Yes, Plan C Pill movie. It's coming out. It's going to be circulated. And it's basically how this company came to be. And it's a nonprofit. And they have a hotline for medical advice, which is, I forget what nonprofit is staffing that one. And then they have a hot warm line, I guess, because it's not 24/7 or whatever, for legal advice. So another pearl that I like to put out there is that if you go to the emergency room, they cannot tell the difference between a spontaneous abortion, miscarriage, and a medication abortion, as long as you don't have any pills in your vagina. So the standard protocol, or not the standard protocol for medication abortion is mifepristone, followed by misoprostol in your cheeks. Wait till it dissolves and then you swallow it. However, they've shown that you have fewer side effects if you take the misoprostol, I believe, or I forget, and you put it in your vagina. So don't put it in your vagina, because if you show up in the ER with pills in your vagina, then yes, they can tell the difference between a spontaneous abortion and a medication abortion. But there is no blood test to distinguish the two.
I do think it's a misoprostol, because I remember on OB we used to use misoprostol for induction of labor in patients that needed to deliver because, well, it was their time, or they were having, it was either, at 40 weeks, or they were having a significant health effect. Maybe it was HELP syndrome. Maybe it was preeclampsia. These are all things that are
complications of being pregnant.
Complications, and HELP syndrome is actually one thing that should be considered. It's very life-threatening.
Yes.
And so
hypertension, elevated liver function, and low platelets.
Yes. So if you're pregnant and you notice your blood pressure goes up a lot, please do see a doctor. That is actually a very bad sign.
A medical emergency.
Yes.
You need to deliver or terminate, but usually deliver. You're usually like too far.
Yeah. Hopefully it's deliver in these cases, most usually are term.
Yeah.
What other things can we do? I mean, that was a great tip. I think.
Yes. I have a couple more tips. Dr. Yen's tips now that Roe v. Wade is gone. Number 1, know about plancpills.org. Number 2, know safe places to get abortion information. And so if you Google abortion clinic, 70% of the time you'll be served a fake medical clinic, aka crisis pregnancy center. But there'll be like Women's Pregnancy Health Center. We give you free diapers and clothes and an ultrasound and pregnancy test. And these are funded by, actually, the government has funded some of this. Our tax dollars have paid for some of this. These are religious organizations who have no legal binding to protect your personal health information. So they can be like, oh, when was your last menstrual period? And then you do a pregnancy test and it's positive. And if you don't have a baby in 9 months from that date, they'd be like, what happened? And they could try to turn you in, as exactly as you said. In Texas, there's a bounty law, minimum $10,000 that you can get for reporting somebody else who had an illegal termination. And so, 1, these are not necessarily medical professionals. 2, it's a religious organization, so they are not bound by HIPAA, Health Information Portability Accountability Act, but privacy. They can collect your data and find you and follow you up later. And so instead, you need to know about the National Network of Abortion Funds. They have a fund in every state. And if you need money, you can apply to the fund for termination of pregnancy, travel, childcare, whatever it takes to get you what you need. And then if you have money, please donate to National Network of Abortion Funds. And then there's NAF, the National Abortion Federation. These are providers, doctors, nurse practitioners, physicians assistants that are safe, trained in abortion. They have a conference every year. They have to hide the location because the anti-abortion people like to threaten, bomb, kill, etc. So they are the legit safe people. Number 3, know your birth control options. Now is not the time to have unplanned pregnancy in 26 states. I'm about to run through all the birth control options from most effective to least effective, simply to tell you the options, but also I think you can be surprised, not you, Dr. Simone, but other non-doctors are going to be surprised that ready, set, go. The number 1 is the implant. It beats vasectomy, which is the gold standard, which like blows my mind. So the implant goes in your arm. It lasts for 3 years. My joke is when my daughter was 10, a 10-year-old could put it in. It's pretty easy to do. And the main side effect is maybe some breakthrough bleeding that could be handled. So that's
one thing about the implant is it's approved for 3 years, but it's actually good for 5.
Yes. So there's the implant. Then comes vasectomy if you're permanent and you're cool with that. And then comes the IUD with hormone beats tubal ligation, which is the vasectomy equivalent in those of us with ovaries and tubes. And so it's snip, snip, burn, take out an inch. And somehow the IUD with hormone beats that. And then below that is the copper IUD. Know with that, a lot of people are like, I don't like hormones. And so they go with the copper IUD. But know that the 2 side effects, more blood, more cramps. But each person is different. So if you're the kind of person who's like, oh, is that blood running down my leg? Great candidate, great candidate. If you're like me and you feel every single cramp, every blood coming down, maybe not a good candidate. And if you have anemia, definitely not, because you'll bleed like stink.
Interesting thing about the copper IUD is it can be used as a morning, kind of a morning after pill.
Yes, emergency contraception.
So it can be used as monitored contraception, I think, up to 5 days after that. So you can go and get one put in.
Yes.
And it's also lasts for like 13 years. Yes. So if you're one of those people who doesn't cramp a lot and doesn't,
mind doesn't have
blood. It doesn't mind extra bleeding, and you just want to forget about it, it might be the choice for you.
Yes. 13 years is pretty amazing. 3 to 5 years is pretty amazing. Permanent is pretty amazing as well. We'll hit emergency contraception next. But let's just finish. We're at copper IUD. Then we're at shot, which is every 12 weeks. The negative on that is if you're heavier, it gives you everybody munchies. But if you're heavier, you're going to gain more weight. It's just a percentage of weight. And if you're heavier, you generally are eating less healthier stuff. And so that just propagates. If you're skinny, it's not good for your bones, but it's better than being pregnant, because being pregnant sucks calcium off your bones far more than the depot shot. And once you come off the depot shot, your bone density goes back.
Yeah, that was what I was about to say. Your bone density does.
And so there's a shot. Then there's a 1-year ring, which I think is amazing if you're 30 and above. I'm an adolescent medicine specialist. So in general, we recommend 30 micrograms of estrogen until you're 30 for your bone density, particularly Asians, Blacks, Latinos who have lactose intolerance. If you have strong, big bones, then probably okay. But if it were me, my daughter, my friend, I'd stick to the 30 micrograms of estrogen until 30. And unfortunately, the 1-year ring only has 13 micrograms of estrogen, not 30, which is 30. We recommend 30 until 30 years old for your bone density. And then there's the Nuva ring, which is every month. That has 20 micrograms. So we don't know how good that is with your bone. And then there is the patch, and then the ring. Sorry. ring, patch, pill, the pill. And then comes, condoms. We recommend, and I always have to do a plug, condom bag. We recommend condoms plus a hormonal method for prevention of unplanned pregnancy, because you want to prevent sexually transmitted infections. But also, as a feminist, I don't like to leak semen for 24 hours or mess with my vaginal flora. The semen water washes all over your vaginal flora. So another reason to use condoms.
Also, if you are a latex allergic person, please, you should be aware that there are multiple types of condoms. There are polyisoprene, which basically act like latex. It's basically latex with the allergens removed,
Nice.
and they cost about the same. Like Skin is a polyisoprene condom, Lifestyle
I
Skins.
didn't know that.
Yeah, there are ones that are basically you basically can't tell the difference, and they also will come in ultra thin and all those options. And then there's the polyurethane one. Now that one's more one size
Crinkly, I
fits
heard.
all. It is like a plastic bag, but it's very, very thin. So just because you have a latex allergy doesn't mean you can't use condoms, and doesn't mean that they're just, you just have to be a little more selective with which ones you buy.
Yes. And I don't make any money, but I love condomdepot.com. They rate it from person with a penis, gave it like a B plus, person with a vagina gave it an A minus. And so at Stanford's clinic, we like to optimize the rating and give you the best condom with the best sensation without greater risk of poppage. Because I think if you get the good stuff, and that's my hashtag, get the good stuff in life and etc., then you're more likely to use a condom than if you have a thick condom, you can't feel anything, blah, blah, blah. But sometimes there's the fun ones, glow in the dark, different colors, flavored ones. Flavored ones I wouldn't use so much for vaginal sex as much as oral sex. And I love that we can see Miriam says Kiss-O Mint are great for oral sex without spermicide. And yeah, at our Stanford teen clinic, we have lots of different flavors. Cola, I don't like banana, grape, good stuff.
Also, don't forget the lube when you're using condoms.
Yes.
A lot of problems that arise using condoms because you're not using enough lube. So
Yes.
get lube. Some people might have sensitivities to certain kinds of lube. Some people can't deal with glycerin or propylene glycol, but there are natural lubes out there. So keep trying until you find what works for you.
Yes, and do not do oil-based stuff instead of
Yeah.
lube. Don't get creative with whipped cream because that's oil. It can eat through the condoms, or anything with oil, baby oil. No, 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 or like people use olive oil and stuff like that. But like, again, it will eat the condom, which is kind of defeating your purpose kind of thing, but can be used for other things.
Yeah.
Emergency contraception. So this is one that a lot of physicians don't know. So this is what your doctor doesn't know could end you up pregnant, but basically what your health practitioner doesn't know could end you up pregnant. If you're sexually assaulted and you end up in the ER, the copper IUD is the most effective emergency contraception. And exactly as Dr. Simone said, you have up to 5 days to get there. And it's actually equally effective throughout the 5 days. A new paper came out in 2021, I believe, of January. So now it's been 2 years, that you can actually use the hormonal IUD. And I believe it failed 1 out of 312 times. So that's a pretty good stat. And it doesn't have the bleeding and cramp side effect. But, you got to weigh how little of a risk do I want of getting impregnated by my rapist versus and having some blood and cramps versus the hormonal one where you have a 1 in 312 chance of getting pregnant. Using that. Next comes, and again, I don't get paid by this company. I just don't want people getting pregnant. Ella. So Ella's prescription emergency contraception, just like Plan C, you want to get it in advance, kind of sitting in the corner like a fire extinguisher where you're like, the condom popped and I wasn't using anything else. Where's the Ella? Instead of like, oh my God, it's 3 a.m. I need my doctor to call it in. Do I have a prescription? Do they have it at the pharmacy? Can I get there? Is blah, 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 blah. Does the pharmacy have it in stock? Just like way too much drama. Deal with that ahead of time. And so, yeah, have a pack of Ella ready in case condom pops and you weren't using anything else, or God forbid your friend was sexually assaulted or something and they don't want the IUD, or either the IUDs. And then comes Plan B and all of its generics. And it's really important to know that check your BMI. I know people are anti-BMI, but this is basically just science, okay? We need to know your BMI because if your BMI is 26 or greater, Plan B and the generics don't work so well. And if your BMI is 30 or greater, doesn't work at all. And about 2 out of 3 people with uteri have a BMI 26 or greater. My BMI is 25. And if I eat a little extra dessert, which I've been doing lately, and not enough exercise, then you may have a BMI of 26. So
yeah, I heard something about it being a lot less effective even if you are weighing more than 176 pounds, which even for tall people, your BMI, that might be a BMI of 25 if you're
yes.
tall enough.
Yes, exactly. And so that's why I don't like the pounds thing because that assumes you're a certain height. And so that's why I like BMI. BMI adjusts for height. And what it is about volume of distribution. And one physician actually tested doubling up Plan B and she thought it would work, but when she actually did the study, it didn't block the egg from popping out, which is the main mechanism of Plan B and its generics. And then lastly, if you're stuck in the middle of nowhere, you could take 4 birth control pills, now 4 in 12 hours. The goal to get to 1 milligram of 1 milligram of norgestrel. Yes. Now, and 100 micrograms of ethinyl estradiol, and again in 12 hours. But that is the least effective method. So I wouldn't use that. But
And
if
that
you
is
got nothing
have
else,
birth control on the ready. Like I don't think. I mean, if you had a problem, you probably are not sitting around with birth control, and you don't want to ask your friend for 4 of their pills because then they're left out. I mean,
if you're in a
if they're not
pharmacy
having
and you
sex,
could just
they're
pop any
probably
drug.
yeah. If you could get a pharmacy, you could probably get the Plan B as opposed to. Unless you have some
Or
old ones left leaving around, but you don't want to, or yeah, Ella actually is better. But you don't want to ask your friend to have to go without their birth control because birth control is also used for other things. It's not just used for protecting against pregnancy. It's used for let's see, endometriosis for helping with the symptoms. It's well, I know
polycystic
your pet
ovarian
project is
syndrome.
women don't need to have their periods all the time. Hashtag
Hashtag
periods optional.
exactly.
It's used for PCOS. Many women who are not sexually active, oh yeah, acne. I mean, this isn't a test, but it's used for so many things. And women that aren't, there are many women that aren't sexually active that are taking the pill for other indications. Because as I mentioned earlier, mifepristone has off-label things. The one that's on the label, it's also off-label use for systemic fibroids and endometriosis that doesn't respond to other things. But that's not actually on the product insert. I actually read the product insert earlier.
Nice.
But birth control is also used for those things. So just you gotta think about that when you're going into this.
Yes. And the number one cause of missed school and work for a 25-year-old with a uterus in the United States, but also other countries, but in the US of A, is painful or heavy period. So if you are missing work or school, please see a doctor or provider. We have drugs for that. And know that the first line drug, assuming you have no kidney problems, allergies, or ulcers, is 600 to 800 milligrams of ibuprofen 3 times a day with food so you don't get an ulcer for up to 5 days. And that will decrease your bleeding and pain by 30%. And it needs to be ibuprofen, not Tylenol, because of a mechanism with prostaglandin.
I think Aleve would also work, but
yes,
it has to be a non-steroidal anti-inflammatory, not
at the right dose.
Yeah, at the right dose. Something, something's on that brain cell that I had a question for you.
Yes. So I think we fertility awareness methods, etc. We went through all the birth control, we went through all the emergency contraception, and then set it and forget it. The whole reason we created Pandia Health was I was giving a talk to a bunch of doctors. why don't women take their birth control? And one of the top reasons was didn't have it in my hand, didn't have time to run to the pharmacy every single month. And then the insurance company, if you went on Sunday before the Sunday you ran out because you're being very responsible, right? They're like, no, it's 8 days ahead. We can only fill it 7 days ahead. And you're like, but I have work and children and school the next day. I don't have time. I'm here now. Please give me the drug. Like, sorry, come back tomorrow or pay today. And so the whole point is set it and forget it. Let Pantia Health worry and query your insurance. Can I fill it now? Can I fill it now? Can I fill it now? And then we send it to you. If you have a prescription and insurance, thanks to the Affordable Care Act, Obama Biden, no copay, no deductible for any FDA approved birth control for people with uteri. And as long as you're not demanding a specific brand when a generic of that same exact dosage and strength is available. And then you pay us nothing and you get free delivery, some goodies, some education. If you need a prescription, then it's just $30 once a year to use our expert doctors. We can prescribe in 15 states and we encourage birth control tourism. So the example is we're in New York, but we're not in New Jersey or Connecticut. But who in New Jersey and Connecticut can't get to New York once a year? Fill out a questionnaire, pay us $30. Then our New York doctor, are you in New York? Yes, I'm in New York. Can write the prescription and then we can mail it to all 50 states. So yes, get your birth control automated.
$30 is actually cheaper than a lot of copays.
Yes, and it, as I like to say, we bring expert care to wherever you have internet in the mailbox, and nor rain, nor sleet, nor snow is going to block the birth control because we use the U.S. Postal. We're riding on their expertise and their delivery, and we're about care, convenience, confidentiality. And then the other Dr. Yen tip is if you have a period app, you and I both went to MIT. We have lots of friends that do computer forensics. So if it was ever on your phone, even if you smash your phone, if it's, synced to the cloud, and there are things syncing all the time against your will, you don't know, between Google and whatnot, then it can be found. So if you are in a state where there is the bounty law and they're like, oh, Sophia missed her period. Then she went to California and then she came back and it was fine again. And it's on your phone. They can find these things. So it's really important not to delete your period apps, do it on paper. Don't share with anybody who hates you, jealous of you, or would turn you in. Be careful with that. And then same thing with your search records. And as you may or may not know, in general, there was a mother-daughter that communicated on Facebook Messenger and were sent to jail because they worked on a medication abortion together via that mechanism. And people are like, what about HIPAA? The two exceptions to HIPAA are legal. So if a judge subpoenas medical records, we release them. And then the other one is to pay your insurance. So know that not everything is confidential.
Also, if you're trying to arrange this, you should download something like Signal, where it's end-to-end encrypted and you can delete messages if necessary. And also, if you're trying to Google this stuff, you might want to, for some reason, you might want to invest in a VPN, because then you can place yourself, basically your internet service provider or anything can't track you because you are going through something else. So
or
those are ways.
Use a public computer like the library or school.
That also works if you don't want to, get a VPN. These are, just some tips and tricks to try. I hope no one's neither of us are in Texas. We're actually both in California. So we are just here giving information about staying safe and how women should be considered humans and equal to men in terms of healthcare, because in general, it's being a woman tends to create worse outcomes. A lot of women's pain is not considered. And it's even worse if you're a woman of color. Even if you're of a high socioeconomic, even if you're of a high socioeconomic class, like if you're a rich Black woman, they found that the outcomes of pregnancy and other health issues are just as bad as if you weren't. And we need to address that. That is something that is
That is
problematic.
structural racism, or that's just blatant racism. Like, how is it that Serena Williams almost died? She, had an educated Caucasian husband, and she's famous and rich. And if it can happen to her, it can happen to anyone. And that's just so wrong. Um, Black women have so many times more maternal mortality, and just so everyone knows, it's up to 1 year after the birth, because you can leave the hospital and then bleed out. You can leave the hospital and have high blood pressure. You can leave the hospital and get a blood clot in your lungs. There's all these kind of complications. So don't let anyone dismiss any symptoms you have. Speak up for yourself. If they won't listen to you, sometimes you have to bring in a person who's XY to come speak on your behalf, or borrow the privilege of your Caucasian doctor friend and be like, help me, they're not listening. Just whoever you can to protect yourself, your cared loved one, or whoever's being affected by that health situation.
And you could always seek a second opinion. Um, if like any doctor worth their weight of salt will not be offended if you go seek it a second. Well, okay, surgeons will be offended if you go to another surgeon after them. They're like, my patient's my patient. But you could always go seek a second opinion from another medical doctor, whether you need to go to urgent care. And if you go to an urgent care one time, you're probably going to see another doctor if you go again later. And
Or
most
go to the
doctors
ER.
are,
Escalate.
yeah,
Escalate.
if you need to go to the ER, go to the ER. And but you can always go seek a second opinion. We doctors are humans. We don't know everything. A lot of times we say learning medicine is like landing on Mars. You learn what's around you. And we keep studying, we keep researching, we keep trying to, find more, but we don't know everything. And I'm always learning new things about medicine that I didn't know. Um, Now, bear in mind, I don't have a license, but I'm still always learning.
And then lastly, get angry, get active. It's not okay, exactly as Dr. Simone said, that those of us with uteri are second class citizens, that in certain states we have to be on the cusp of death before a physician or somebody, healthcare provider, can step in to save us from something that wasn't going to live anyway, and that could only result in termination of itself. So vote for, volunteer, donate to, and if there's nobody that supports bodily autonomy, freedom of religion, run for office. There's many people that are XX that don't run until you've been asked. So I'm asking you if you support reproductive rights.
Should
And
I run for office?
yes, you run, Dr. Simone. You're a physician. You went to MIT. You speak up for people. We need more physicians in Congress. We need more people with uteri in Congress. And certainly there are allies, but there are not enough allies. And I like the phrase, if you're not at the table, you're on the menu. So you do not want to be on the menu. You want to be at the table. And I love that. I think it was Shirley Chisholm said that, if there isn't a seat for you, you bring a chair. You make room at the table. But we need more representation. But we also need this country to wake up that it is unacceptable to treat 50% of its population. And I wear this uterus necklace to remind us that we all came from the womb. None of us has an artificial womb. We all owe a womb. And my dad says, this is life. Respect the womb. My womb, my choice. Your womb, your choice. You have every right to try to convince me, but my womb, my choice. My family, my choice.
Yeah, we all have a mother. We have
We all
it.
we owe a womb.
Yeah.
Otherwise, we wouldn't be here. So why is that a second class citizen?
Yeah. Why? I mean, I could go on a whole other soapbox about women in medicine. I'll bring that up another time on my channel. If you want to subscribe to my channel, it's youtube.com at Dr. Simone 42. When I get 1,000 subscribers, I think I get to lose the number.
Nice. And you all should know Pandia Health. You can find us on Insta, Facebook, TikTok, LinkedIn, YouTube. And if I forgot anything else, it's at Pandia Health. Pan is every, Dia is day. I made that up. And then Pandia is the Greek goddess of healing, light, full moon. Purposely chose that name because we're about women's empowerment. Not Panda Health, Pandia Health every day.
Well, one thing also you guys should know about Bandia Health is it is the one provider that's actually was created by women doctors. So it really was created on a foundation that it is by doctors giving competent medical care for women. I mean, that's what one of the big things that differentiates Pandia Health from all of the other birth control providers on the market.
Thank you so much for that. Yes, we are the only doctor-led, the only women-founded and women-led. We do have 2 male doctors on our team, but they are very cool allies. And we are about expert, evidence-based care because we're going to go into menopause next, and that is the wild, wild west, meaning there are people doing crazy things. Anybody doing pellets out there, that is crazy talk. And so know that that's happening. I wouldn't suggest it. I don't even understand how that's medicine. There is medicine involved, but I no self-respecting physician, I don't think should be doing that. And so we're about expert care by expert doctors that is evidence-based, personalized. We have an algorithm that better serves everybody of every race and BMI and age, because as an adolescent medicine doctor, I pay attention to bone density. BMI is just limitations of what works, what doesn't work. And then realizing what we were taught at the standard medical schools works great if you're a Caucasian female that wants to bleed every month. But if you're an Asian woman or a Black woman, that doesn't work so well. So found a better algorithm with fewer side effects. And we have 82% retention at a year versus 55%. So if you want to hashtag get the good stuff, come see Pandia Health. Know that there are 40 different birth control pills, 8 different progesterones. If you don't like one, note that one and know that there might be a lower or higher dose, but there's 7 other ones that you could try.
And also don't forget the implant, the IUD. If you are a person that forgets to take pills, those are actually probably your better options.
Yes, the implant is number 1. And then the IUD is number 3. And that's pretty amazing.
I mean, if you have an implant, then you could say you're an android.
No, no cyborg. No.
I know, bad joke.
Please, there are like technophobes, and we're from MIT.
Okay.
Well, I want to thank you, Dr. Simone, for coming here today. I want to thank everyone who listened to this and who's listening to this and who will share this with other people. Please follow Dr. Simone on her socials and her YouTube channel. Please follow Pandia Health, the only doctor-led, the only women-founded, women-led, the only academic doctor-led company in the birth control space. And I wish all of you good health, and we'll do this again.
Yeah, we should meet up and talk again soon. Probably in a few months. We're very busy.
Quarterly.
Yeah, let's have a quarterly live chat for the masses.
That sounds great. And any questions, hit us up in the comments. We'll try to answer them.
Yeah. Well, there was one question that I saw. What are your thoughts with the Plan B taking out of Americans' hands? I would pop 3 birth control for 3 days.
So I think maybe they're saying Plan B in the United States is over the counter, and maybe they're saying take it out of over the counter, but I don't think so. And I think the pop 3 birth control for 3 days is simulating, as I mentioned, the 4 birth control pills now and in 12 hours. is the standard dosage for that. So 3 birth control for 3 days is not standard in any protocol that I know, other than
Yeah.
if you have uncontrolled bleeding and they're trying to stop that, but that's a totally different thing. It has nothing to do with contraception, to my knowledge.
Oh, I remember what was on that neuron when I didn't. So another thing is if you are using an excessive number of pads or tampons, like, I don't know, 10, 7, 10, 13,
A
that is
day.
not normal. A day.
Yeah.
Not for an entire period. That's actually normal for a period. But per day, that is not normal, and you should seek out a doctor. They will probably start you on some ibuprofen, and if that doesn't work, they might do birth control pills. But having that much bleeding can cause you anemia, and it might be a sign that you have some sort of bleeding disorder. So do seek out a doctor if that is something that you are experiencing, because it, it can change your energy levels.
Yes, the number one cause of anemia in a menstruating woman is menstruation. That was like our number one question, one of the top in OB/GYN, rotation back in the day. And so the signs and symptoms of anemia are you're pale, you feel your heartbeat fast, but your fingers and toes are cold and you're tired. And when I say that, people are like, "Ooh, that's me. I bleed a lot and I'm cold and I'm tired." So please check anemia. And then as a pediatrician, we usually check anemia, but we don't check iron. Nobody checks iron deficiency until you have anemia. But the research has actually shown that if you don't have anemia and you have iron deficiency and we give you back the iron, you do better on math and you do better on IQ. So without that iron, you're not yet anemia, but your brain isn't functioning as fast because you don't have all the oxygen that you should be getting from the red blood cells because you bled them out.
But a
Another
note on
reason.
iron, you
Yeah.
can take too much.
Yes.
You should be very careful when supplementing iron. Start with low dose and make sure you take it with some sort of acid like orange juice. But unless you're prescribed 150 milligrams a day, don't take it.
Yeah.
It's too much iron, and also check and make sure your multivitamin doesn't have iron, because taking too much iron can also be toxic. So I wanted to make sure that we put that in there, because I don't want a bunch of people thinking, I feel crappy, I'm going to go out and get some iron, and they overdose on iron because of what we said.
Yeah. Only take iron if your doctor gave you a diagnosis and told you to take iron. Though a lot of the women's vitamins have a little bit of iron because they assume that you're bleeding.
And a little bit is okay.
Yeah.
A lot is not.
Yeah. Don't just take iron pills. Ask your doctor or provider.
Yes, ask your doctor, and there's ways that they can check it using standard blood tests.
Yes.
So, and with that note on iron, considering that is something that women deal with a lot, we are at an hour, and I think it's time to call this a day. Thank you, Dr. Yen. It was great talking with you. And if you have any more questions, leave them in the comments, and this will be I don't know if you're going to see it on Pandia's Health website, or I'm going to be posting this on my website. So we will answer questions
everywhere.
Yeah, we're going to put this everywhere because we think it's an important thing to get out, and it's definitely going to be a little censored by the YouTube algorithm because we have mentioned the abortion word multiple times. So we need to get the word out.
We use many words, I think, that will be censored. I tried to
Yeah.
be good.
We try, but it's really hard when you're talking, when you want to say something.
Yes. So thank you. And I don't know if Claire is still with us, but we could also just hit the